Hi, my name is Dr. Paul Gallardo. I'm in Miami, Florida. I'm a periodontist. So I get a lot of questions about the pinhole technique. The pinhole technique is basically a technique that does not use your own palatal gum tissue to do a soft tissue graft or a gum graft. What we do with a pinhole technique is we basically make just a small opening with a needle up high above the gum, and using tiny instruments that have special angles to them, and think microsurgery, but also kind of think laparoscopic surgery. So think of us doing everything from this tiny little opening. What we're doing is we're placing these instruments that go behind the gum line and just loosen the tissue so that it drapes over the tooth, or it drapes over the part of the gum recession. So if the root is exposed, by releasing this tissue through this little pinhole, what we're doing in essence is we're detaching the fibers, and it just allows the draping of the tissue. Now, instead of just leaving the tissue as it is, what we do is we take strips of collagen, small little tiny strips, and we're feeding these strips into the pinhole to basically reinforce the back of the gum line. What's really nice about this is that most of the time we don't require stitches or sutures, and there's really no cutting with a scalpel. So the healing is actually very, very nice. The results are pretty much instantaneous, and because we add growth factors to this in every technique that we do, we get enhanced or accelerated healing. And by growth factors, by the way, I mean every case, every surgical case that we do, basically draw blood from the patient's IV line, won't even know it's happening for those who are needle phobic, and then our technician processes the blood and then isolates proteins, and this is happening on the spot, same appointment as the surgery, isolating proteins. These proteins are then applied to the surgical site. The growth factors serve as magnets to cells, so basically it's enhancing the population of cells that need to come onto the site. In this case, it would be gum cells or epithelial cells and connective tissue. So I hope this helps. There are other alternatives, obviously. There's the pinhole technique, there's Alloderm grafting. There are many other techniques that don't involve having to cut the roof of the mouth. So modern technology has really expanded our armamentarium for giving you really nice results without the trauma and without the invasiveness. So hope this helps.